To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey, and welcome to Your Health. Today we're talking about GERD. We'll tell you what that is, what symptoms there are, and how to treat it. I'm joined by Dr. Tim Edison of Surgical Associates of Neenah. And doctor, let's talk about GERD, what it is, what are the symptoms, and we'll get into how we treat it.
Thanks for having me. GERD, or reflux esophagitis, very common condition. This is where you have contents from your stomach, acid, bile, digested food, kind of moving backwards or refluxing up into your food pipe. Most common symptoms are heartburn. Sometimes a person can have chest pain that's not coming from the heart, chronic cough, difficulty swallowing, things like that.
What would some symptoms look like for us?
Most common one, of course, is heartburn. And that's really how it's diagnosed. If someone has occasional heartburn, say once a week, that's probably not going to be a serious problem. Someone has heartburn more often than that, 2 to 3 times a week, that person most likely has reflux esophagitis.
And unchecked, what does that lead to?
The most serious complication is esophageal cancer. We know now that chronic reflux esophagitis can lead to a condition known as Barrett's esophagus, where cells in the bottom of the food pipe have turned pre-malignant. Most esophageal cancers do begin this way.
So when we think about diagnosis, what does that look like? I go in, I'm having those symptoms. How do you diagnose me?
The gold standard is to do endoscopy. Endoscopy is a simple test which is done while the patient's sedated. A skinny, flexible camera is placed in the mouth. The food pipe is very, very carefully examined and painless biopsies are taken.
Let's get into treatment options. I know that I've got diagnosed, so what do we do to treat it?
We typically use a step-up approach. For folks who have mild reflux esophagitis once or twice a week, dietary changes, avoiding fatty foods, chocolate, certainly giving up on tobacco, alcohol, cutting caffeine, soda pop, things like that. Over-the-counter Tums is fine. Over-the-counter Pepcid is fine. Folks who are having more frequent heartburn, a over-the-counter medication such as omeprazole or Prilosec can be taken, also can be prescribed as well. But it's really important that at that point, this patient needs to let their primary care physician know that these symptoms are occurring and that they probably should be evaluated at some point by a specialist to have the endoscopy done.
Well, doctor, I want to thank you so much for being here and covering what GERD means and helping us out. And I want to thank you for watching To Your Health.
The preceding was a paid advertisement.